A young couple finds out they're expecting their first child. The day arrives when they will meet their newest addition. The hustle of getting to the hospital, the waiting, the pushing. A new life is born, and a moment they had imagined 1,000 times before changes in an instant. The young couple is told that their baby has an abnormal physical exam, making their doctor worried about an underlying condition or syndrome. Immediately, the baby is taken away to the neonatal intensive care unit. Elation at the birth of their son suddenly turns to shock and fear. Why is my baby so sick? Why is this happening? Is my baby gonna be okay? My name is Sabrina Malone Jenkins. I am a physician scientist in the neonatal intensive care unit, and my research is entirely based on trying to answer those questions for parents. I'm often inspired by the quotes, "A woman who loves walking will walk further than a woman who loves a destination." And so my walk begins. I began my fellowship training here at the University of Utah in 2014. In the state of Utah, 10 to 15% of babies are admitted to a neonatal intensive care unit. At the University of Utah, we admit 900 critically ill infants each year with a mortality rate of 5.4 infants per 1,000 live births. The reason for admittance can be apparent, say in cases of prematurity. Yet all too often, the reason is unclear. As one of their providers, I know that it can take months to find a diagnosis. The baby is evaluated by multiple subspecialists, each with their own list of laboratory testing, imaging studies, and sometimes painful procedures trying to uncover an underlying diagnosis. My goal is to find an answer sooner rather than later, and to spare these patients and their families from the odyssey of testing and unanswered questions. To do this, we started utilizing a test called whole genome sequencing. This comprehensive genetic test looks at all of a human's genetic material, including over 21,000 genes. Many genetic variants have been linked to multiple diseases, including metabolic disease, epilepsy, and neuromuscular disorders. In 2003, the first whole genome was completed. It took 13 years and $2.7 billion. In just 20 years, we are doing this testing in less than a week and for a few dollars cheaper. The turnaround time is so important in the NICU, where morbidity and mortality rates are so high. For NICU babies, every day without a diagnosis is a day that they could be receiving a therapy that could help them, and their parents' questions remain unanswered. As the principal investigator, I created the Utah NeoSeq project to decrease the turnaround time through a rapid whole genome sequencing program, where every step of the pipeline is accelerated to find a diagnosis as quickly as possible. Our team averages 5 days to a diagnosis. We're able to find a genetic diagnosis that aids healthcare providers in personalizing their care to each individual patient in real time. Our study has impacted the lives of 65 families in the University of Utah NICU. Of those 65, 26 received a diagnosis, and parents' questions of why and how were quickly answered. For one family, it meant spending time at home rather than in the hospital. For another patient, it was targeted interventions and a shorter hospital stay. And for many of our families, it's valuable information for future children. By making these diagnoses, we're also understanding these conditions better, making it so we will be able to help other children in the future. And we're expanding the science by discovering some novel variants along the way. The strength and the power of the University of Utah is displayed through our multidisciplinary team. We cross departments and divisions, from pediatrics and neonatology to medical genetics to human genetics to molecular genetics. Our sequencing is done at ARAB Laboratories, and our raw data analysis is done at the Utah Center for Genetic Discovery. These two teams then come together with the Department of Pediatrics to interpret what this genetic information means for our patients. The impact of our team is greater than the sum of its parts. Even though we've seen great progress, our work is not done. Genetics is still a young field of medicine with new advances and discoveries made every day. And even though we have found a diagnosis 40% of the time, that still leaves parents with unanswered questions. The NeoSeq project and the ReSeq clinic are now pushing the science forward. As children grow, new symptoms emerge, discoveries have been made, and technology advances. By doing reanalysis, we are maximizing our efforts to uncover an underlying diagnosis. RNA sequencing allows us to delve into the functional aspect of DNA. It gives us insight into how this genetic information is expressed in the body. Long-read sequencing allows us to look at larger DNA segments and gives us access to segments not easily seen in short-read DNA. And when a when a genetic change is found, it's important to be able to develop an animal model to be able to understand the effect of that genetic change and explore potential treatment options. I'm so proud to share that this work has led to an NIH K08 award, which is a mentored career development award for early career investigators to get their research started. Mine is an implementation science project, taking rapid whole genome sequencing out to NICUs throughout the state of Utah. This technology should be accessible to all of our acutely ill patients and their families. A woman who loves walking will walk further than a woman who loves a destination. I am the first in my family to go into healthcare. I've known from an early age that I wanted to be a doctor and I wanted to take care of kids. What I didn't know was how many times I'd be told no, how many times I'd be rejected, or how many times I would trip, stumble, and fall on this walk. When I applied to medical school, I was told by a dean I should pursue a different career. When I applied to residency, I got more rejections than interviews. And when taking one of my board exams, I failed by 1 point. Don't worry, I passed it the next time. But for those researchers just getting started, please know that for every success I've had lots of disappointments. But I believe both my successes and my failures are getting me to the place I want to be. On this journey, on my walk, I must also credit the amazing mentorship I have received throughout my career. During residency in Nebraska, I had the opportunity to work with Dr. Ann Anderson-Berry, who is a strong, successful female physician scientist. She represented to me someone that could do it all. My mentorship I have had and continue to receive here at Utah is nothing short of inspirational. Dr. Gary Chan taught me to love the process of doing research and the art of actively changing our clinical practice for the better. I am so honored to carry on his legacy as the Gary M. Chan Endowed Chair in Pediatrics. And to Dr. Marty Tristani, who has been there from the beginning, answering all of my questions and making sure I'm on the right path. I choose to continue this walk because it is deeply personal to me. At the beginning of this talk, I told you to imagine a young couple and their uncertainty as to why their baby was so sick. Unfortunately, that baby died at 6 months of age and never had the opportunity for genetic testing. However, that young couple did go on to have 2 healthy children, myself and my older brother. And now I've dedicated my career to answering those questions for other parents.